Hey guys, so this is Val. I'm doing the second half of our presentation on anorexia. So this is the article I found, Initial Evaluation, Diagnosis, and Treatment of Anorexia Nervosa and Bulimia Nervosa. Okay, so I'm going to just go to our PowerPoint. I just want to show a clip of the article. So the article starts off talking about just some facts about every 1 in 200 adults is diagnosed, and then it's like four or five out of 200 for bulimia. So it's very rare, I guess. 95% are between the ages of 12 to 25, and often it's a result of society. It was also stated in the article, I left it out of here, that parenting is not really a factor. It can be a risk for it, or like environmental factors and things can be a risk, but it's not really a big cause. A lot of it is like societal views, I guess. And then they kind of talked about clinical presentation. So people diagnosed are often comment on being fat. And then weight loss may go unnoticed for a while because if they're wearing baggy clothes, which is pretty common. Oftentimes they have really good cognitive functioning and verbal fluency, so they're not really affected in that respect, and they're wearing baggy clothes. So it's like kind of hard to detect. So I guess that kind of goes back to 1 out of every 200 being diagnosed, but that's probably what's reported. So I'm sure, there's a lot of other people who aren't officially diagnosed. Okay, so moving on. So the article goes on to talk about the screening process, which starts with measuring height and weight and BMI and things. And then there's also a questionnaire they mention called the SCOFF questionnaire, which just identifies like kind of the person's relationship with food, I guess, and like, do you ever eat so much that you feel sick, or just like things like that, like how do you kind of feel about food? So I guess that's like the kind of the first step, and then they talk about the evaluation process. So I'm kind of focus on identifying emergency medical conditions, like things that might warrant being hospitalized, or like anything that like really needs like immediate attention. So they will take a urine sample to assess if there's been any kidney damage. Often they will weigh the person with them facing away from the scale so they don't see how much they weigh. Like that can be a trigger for people. Okay. And then okay. And then so then the article goes on to talk about treatment possibilities. So family physicians are often involved so they can monitor the patient's weight. There can be psychotherapists to help the client if there's body image dysmorphia or cognitive or mental things going on. Mental health is involved. And then eating disorder specialists, which is stated is ideal, but not always available. And then dietitians to help select nutritious foods that are like full of calories to help gain weight. And then for younger kids, I guess, or like even high school age or whatever, treatment is it's necessary to have the school involved for the younger ages to allow them to have necessary snack breaks and excused absences for treatment or whatever. And then there's inpatient and outpatient, like psychotherapists, and then inpatient if it's very severe. And then and then obviously success can rely on the alliance with the patient and the involvement of the family and how the treatment plan is implemented. And okay, and then so the last slide is just prognosis. So 50% of people diagnosed are fully recover. So that's pretty high. That's pretty good, I think. 30% achieve partial recovery and 20% remain chronically ill. And then it's the highest mortality rate in mental health disorders, which is pretty crazy, pretty astounding, I think. Okay, and then I just found some resources for anorexia. So there are quite a few out there. So NEDA, I guess, or NEDA, is the National Eating Disorder Association. That was the first one that popped up, so I think that's the most recent. Then there was Eating Disorder Hope and Center for Eating Disorders. So there's quite a few sources out there. I saw some other ones as well. All right, thanks, guys. Take care.